to come and give us the path. We'll try and finish the day by around lunchtime. So as we leave, we can go and have an afternoon of rest and then full. And it shows the great commitment we have in this journey. We have two teams which need to present, and this will start by the team on policy, governance. After that, we'll also be having. I say digital infrastructure is the legs, because it carries everything else. So that is the team which will be coming after the governance team, and that's the team which will be winding up with. Then after that, we'll have a presentation from, I don't know if Professor Joisia or Boko will be giving us a presentation of around 10 minutes. Then Dr. Rachel will also give us a presentation of another 10 minutes. And Philip, he will be here at that time, because all the presentations should not to take more than 5 minutes, and we need to be done with them before we break for the team. So those who are to make presentations, can you prepare for that? You have a very short time, just tell us what you have to say. And after that 3 presentations, later after that we'll be having a plenary. And in the plenary, before the plenary, we'll be having Dr. Ryan come and discuss about issues to do with financing. Then from there, we'll have a plenary led by Dr. Joe. And after the plenary, we'll be coming out to see how do we move forward from here. We have already 12 thematic areas. Are we breaking or are we continuing? So Dr. Joe will be telling us clearly the way forward from this meeting. So for now, we go with that, and that is the agenda for today. We're hoping that by 1:30, when we break for lunch, we can break for the day. So I want now to call the chairs for the governance team to come forward and do that presentation. And before I forget, there's a report team. We'll be also able to tell you the status of the report. I know it is a very capable team, actually highly technical, and we hope by that time, Dr. Nelly, Dr. Emma, Joan, Dr. Romana, we had in the same team, Rachel, you'll agree, will show us where we are. So those are the proceeds of the day, and I know we are serving. So,
sorry, just keep scrolling. Good morning. So our team's focus was on governance, policy, and legislation, comprised of members of the Ministry of Health, led by Dr. Joyce, from the Council of Governors giving the county perspective, led by Jemima, with implementing partners for Palladium, Dr. Jacob, and Josephine from Living Goods, and then we had Sylvia from Kenya. So I think it was a very representative team. So Sylvia tries to do the tech. I will continue. So the consensus from the team is that there's quite a bit of legislation and policy that has been drafted or is in drafting incorporated into either the digital health bill that was mentioned by Joyce, the health data governance framework, the telemedicine policy. So most of our recommendations will go into existing policy documents that are in draft rather than starting a completely new policy document. So just 1 minute. Yeah. Okay. We're sorry about that. We're up. Yeah, so as mentioned, group, that's the composition. Our presentation has an understanding, so define the goals, objectives, recommendations with priority, and then a timeline. Our team will talk about a few commitments in the members of our presence.
Yes, so this next slide just highlights what we're going to discuss next, which is the goal and objective. Okay, so the goal of our group discussion was to examine so to examine the various groups in various gaps in governance, policy, and legislation that affect the development, implementation, and sustainability of digital health systems, and propose recommendations to achieve the digital health vision for the country. So this is in order to create an enabling environment for digital transformation.
Consultative, inclusive process of drafting. This has been led by the Ministry of Health, the Directorate, and the legal team from the Ministry of Health, but also from the Kenya Law Reform Adoption by Health Information Systems. And the EMR standards, I think this needs to be updated. And then I think the National e-health policy is still live. And then our timelines. So we have recommendations, and this has 3 month, short-term, medium-term, and long-term recommendations. There are also recommendations that will run across this period. They'll probably start short-term, but they're going to last the entirety of the next 12 months. So on short-term, there's one recommendation to develop and deploy a toolkit for use by data controllers during EHR deployments, and this will include readiness checklists, generic contract and MOUs, and self-assessment readiness for EHR. So this recommendation was born out of a conversation by the teams on how EHRs are adopted in counties' facilities, and are our facilities ready, are our counties ready, and are they able to know what to take and what not to take. So we thought we need a toolkit to be able to guide them for that. Then the second was that we are aware that the partnership framework has outlined the ICC on health information, research, monitoring, and evaluation. But there's need to bring this ICC to life. Within the partnership framework, the proposal by the Health Data Governance Framework is to have a TWG that speaks to health data, and that on the ICC meetings, that health data is a standing agenda, so that when they meet, then there's a standing agenda on health data. But more importantly, how do we bring this already developed governance structures to life? Then finally, there was need for adequate safeguards and protocols for data migrations, and this includes a checklist. And the proposal was to have this either contained in the certification framework or to find which policy documents this will align to. Then the next was to define minimum requirements for design of our healthcare system, again speaking to the certification framework, and to communicate on the digital transformation within the health ecosystem for UI and accessibility. So let's go to the
So for the medium-term and long-term recommendations, we had an establishment for a community of practice, support, and provide technical assistance to the Ministry of Health. And capacity building came up as a very important aspect of what we're trying to do. Capacity building on the contracting process on acquisition of a system, review, update, and disseminate a digital health certification framework, and conduct a stock take on the current investments in digital health. I think that has been touched on by very many people in different groups. And then the next one is to develop an automated registry for EHRs and digital health resources that is updated real time at county and national level. And then develop a business case for digital health investment. This is so that we can popularize the idea of digital health, and then develop policies that manage the integration and standardization of digital health systems across different departments and health facilities, and then develop a regulatory framework for thematic areas such as AI, emerging tech, and including how to connect data from wearables to the health system. So the next slide just goes through commitments that various group members gave. So,
thank you. So our group members were gracious enough, so we made a few commitments. So back from the top, Kehia committed to host and operationalize the communities of practice, Living Goods to support this community of practice, and the Council of Governors committed to support this community of practice, which is really big. And then the counties also, through the Council of Governors, to participate in the TOR developments and take part in all the technical working groups and hearing meetings. The next, IntelliSoft committed to support the development of standards for the EHRs. KHR to support through technical assistance the development of EHR deployment toolkits. TBI committed to support through technical development the EHR deployment toolkits. The Council of Governors committed to leverage the existing structures of coordination to disseminate guidelines and build capacities within the counties. The Council of Governors committed to, through the Human TTC, support development of standards. Stakeholders, including counties through HIS, M&D, technical, thematic counties, that's the TTCs, to provide technical assistance in development and deployment of the EHR toolkits. The COG cell, through the will take the counties to undertake mapping of existing digital health system through either self-assessment report and to support the development of automated registries for EHRs. The responsibilities and accountability by counties for health data in regard to specific county investments in digital health will also be picked up by the Council of Governors. The county still through the COG has a role in integration, standardization, guidelines development, and training. So again, this commitment will be picked up by the Council of Governors. And then to support development of the framework for AI and frontier technologies, and then a group to represent, but with a group of representatives to participate in joint processes with Council of Governors, providing content of best practice and to be able to disseminate the SOPs for the various HI departments. So a lot of commitments from the county teams. And finally, Kenya to support activities through digital health and health informatics technical working groups, and to participate in the HANMA, ICC, and the TTCs. I think that should be it. Thank you.
You can be seated. Can we give them a good clap? They have demonstrated that there is a group of leadership and governance. When you look on their commitments, they did not leave anything out. Am I correct? Yeah, so that was really cool, great presentation from the team. And I think also they were trying to show us that you can collaborate and teamwork in the presentation. It came out very well. That was good. Mine will be this now a time we need to raise issues of concern so that we can have. And before we move to the rest of the teams, that was very great and excellent presentation. You almost left us with no question to ask. But I have one. You have said the version 2 of Kenya Health Enterprise Architecture is ready. Has it factored in all this? Because before you sign it out, I think before we say it's now done, there are a lot of things which are coming out, especially from these stakeholders meeting. Many people may not have been involved in the development, but I'm happy because we're here, and the vision for why we are here, it has not been contested from Monday about the digital health superhighway. So we need to be clear. I know it's pulled out from Kenya. However, this will not come out in that updated version of it. So the other issue is about your scope in terms of again the digital bill. I know we are going to, and so our mission was to make a presentation after this, if it's around. But before even we go for the public participation, we need also to think about what are the inputs to get from this floor. Last but not the least is about the HRM ICC. I don't know if you can use this opportunity. I know we have already the digital atlas whereby we map in the systems and also the stake partners in this. There are people who have never been in that.
Yeah, this is Eric again from that region. Just mine is a quick one. You've heard about the bill, the framework guidelines, all these things. Now, if we want to the framework guidelines, all these things. Now, if we want to maybe review, see what is there, take a look. How do we get them? Now, I'm sure many people would want to make inputs. You can give them.
Yes. Next is Convergence from Solana. Brilliant presentation. Actually, my comment is almost like the previous one, which is how is this published? Is it on the guidelines portal? We even have a digital health category of tag there, so everything that's digital health guidance is just in one place where we're not looking.
So thanks for the question. I think we'll delegate Dr. Ryan to respond to the KHEA.
So Dr. Ryan will speak towards the enterprise architecture. The digital health bill will be presented to the team here today. The MOMO will provide guidance if we will disseminate this. We will share the draft here today for Dr. Joyce will have given us that direction on the Brian. I think dissemination as and access to this policies and legislation was a conversation that was within our groups. And there was a suggestion to ensure that it's accessed through the online downloads from the Ministry of Health, but also from the counties. Then the Council of Governors wants that responsibility given to the TTCs so that during the engagement that they now disseminate it further. So it was a key recommendation to have a clear dissemination and awareness creation on all these policy documents.
Thank you. I find it interesting that that question is coming from Momo about KGA. This is his unit. So I will take it more to be a statement rather than a question. Yes. About it, the interesting thing is this framework is not yet complete. Even one thing I've been repeating to many people is that schematic you see over there is not static. It's not yet complete. This is a prototype that we are testing with the sector, and we will keep iterating it and building upon it depending on how things come. And that is the model we want it to kind of be. So we're still trying to look at as we present an enterprise architecture. How do we allow an enterprise architecture that is easily adaptable and is easily changeable? So even if we're going to update these particular aspects that are going to be here, part of the framework in how we update the architecture will be we don't get an architecture to last for 10 years or 20 years. It will be very reactive to the changes that are coming, especially as we see the entrance of AI. So with regard to the policy and governance issues, maybe I can ask you to comment on AI policy a bit more, some of the work we are doing, just to be a bit clear about that. We should do some work on this and we want to align to this, and then maybe I can finish with a few questions to COG.
All right. Thanks, Dr. Ryan. So I think a bunch of us here who are involved in a couple of I know Palladium through CTC support involved in some AI work, machine learning. Who else is working in that space of AI? Metronic Labs and Empath as well. So the idea is we want to consolidate all the learnings that we have with regards to whatever activities are going on currently. Some are just exploratory. We're doing some work with Gates Foundation as in Tennysoft to explore the use of large language models, comparing ChatGPT and Batch with regards to how those can be used, especially by the youth, to obtain information on NCDs, cancer, diabetes, and hypertension, and not compare those models and see how well they work. But looking at that from an AI in health perspective, and thinking of how then we can start building, developing policies and guidelines.
I was curious, here, there's the down. But my question just for the rapporteurs to catch is I've seen a lot of your governance aspects are stopping at the governor level. A huge part of this implementation of this highway will deal with changing attitudes at the level of the end user, and we see a lot of county assemblies being it's very easy to ignite them into fire. If you want something to burn at county level, it doesn't matter what the governor wants. You go and you start chaos at the level of the county assembly. Are we looking at any types of sensitizations for them to bring them on board in terms of this, because they're also a critical structure in governance, they're the ones who approve the finance bills. A lot of these services are also going to be interacting with the finance bill. We have a whole public hospitals are going to come from finance bills, which are updated every year. We have to look at some engagement with them at that legislative level, not at this national level, not at state level, but at county assembly. Just want to ask if we have considered that and if there's support from that from COG.
I think it was part of the conversations, but we can have that picked up by Jemima from the Council of Governors. Yeah, recommendation is noted.
Okay, there is another question.
Project governance. I remember the day one, Dr. Lambert said the project has to be executed within 1 year. Okay, if that is the case, are we considering about the project governance here with the project planning and the formation of the steering committee. Those elements covered in this governance. That is my question.
Okay. Maybe I could start by responding, and then Mona could help me with building the story. So what we envision is that once we activate some of these governance structures we have, the impact will trickle down into places where maybe the project implementation process will be strengthened. So we want to start from the top with those existing structures that we have, maybe the partnership frameworks, the agreement ICC. Once we jumpstart those structures, the effect and the impact will be felt downwards all the way to the implementation process and the planning process. I hope that helps.
You're running away. Okay, fine. It's okay. Can we clap for them? Thank you. Thank you. That was an excellent presentation from governance team. By the way, when you look about the 7 building blocks of digital, governance runs through and legislation. So that's a very critical pillar. We cannot be here, we cannot move forward without governance and legislation. So I want now to call the guys that will say they are the legs we stand, and this is the infrastructure team, digital infrastructure. When you are, oh, this is the team. This is the new came. Okay. Can you clap for him as he comes?
You didn't want me to come.
No. Okay. Welcome.
Chair. They are saying I'm not chair.
No. Okay, welcome. Zemima, we had 2 questions. But yeah, after this group will give you time. She can brief you on the question on COG.
Good morning. Yeah, the legs have arrived. So the legs will just do what the legs do. Yeah, so we had a team of about 12 who were indicated there, mostly from IT. I think about 3 of us were not from with the IT background. Yeah, so from MOH, partners, and private sector. Yeah, so yesterday we had very comprehensive discussions around cybersecurity, which covers significantly, so that one we will not be able to look at that. The team handled that quite well. And then one of the last statements was the core mandate for Ministry of Health is to provide health services. So there has to be some level of trust for other providers to be able to support the digital infrastructure required to be able to execute the same function, rather than us concentrating on the same. Yeah, so the goal of the digital health infrastructure is just to ensure we have robust, reliable, and secure IT infrastructure to support the superhighway. So basically, everything that we've been discussing today, our work is just to have something that can be able to house it, the way this hall is housing us nicely for our meeting. Yeah, so we had 4 objectives. So one is just to define standards for IT infrastructures and works utilized at all levels. And for these all levels, based on yesterday's discussion, we do not include the data center. So data center comes second as recommending the certification standards for the enterprise data centers, because that's what is required to be able to support the entire place. Yeah, and then to develop or to define a framework for collaboration with private sector, yeah, through the Ministry of Information, Communication, and Digital Economy, yeah, just to improve the last mile connectivity. So basically, we are talking about the people who give us the cellular networks, the internet services. Those are the ones that we require just to be able to reach to all those remote, yeah, places. So we have just to define a framework how we can be able to collaborate and just ensure that they're able to help us get that connectivity. And then lastly, just to define the minimum ICT staff requirements, yeah, for primary care network. Because as part of doing this digital, yeah, to just avoid the health workers getting frustrated and deciding to say, now, can you let me do what I was trying to do? Then it's just to have some people to help and ensure everything is running smoothly and the experience is quite good. Yeah, so we combine everything for recommendation, commitments, and timelines into one so that it can be easier for us to just go through that. And we have about 9 high level, so we have other details which just help to ensure we are able to make this. So one is just to look at the issue of the technical specifications for the infrastructure and the service delivery points. So here we're looking mainly at the health facilities, yeah, where the real action starts. So defining what the servers are required, which kind of networks they can use, and which kind of end user devices they'll be utilizing at those levels. Yeah, and of course when you look much more at enterprise level, then we are looking towards the data center. And this one is saying within 6 months you should be able to complete that. Yeah, and we didn't have a commitment around there, though we had strong indication that ICT, the Ministry of ICT can help support that. And then the second is to provide optimal connectivity options based on availability and just ensure that we have adequate redundancies. I think at the bare minimum in all of our sites, the redundancy that we can have is the cellular network. Yesterday, there were some questions about connectivity. There's a challenge with that. Yeah, so just to remind the audience that it is 98% penetration or coverage for the population and around 60% geographical coverage. So cellular network is quite fair. And then this week, we had some disruption in this country in terms of internet. So Elon Musk has finally arrived. So even if we only have one Tesla, at least the internet has finally arrived. So there was some quite significant disruption within the internet space. And now we have the Starlink that covers the entire of this country with very good bandwidth. Yeah, so that one is quite handy and handles the issue of satellite. So in terms of connectivity, you can say those two are fair, quite good. So fiber penetration and no-fee will be just be something that we're working on, and Ministry of ICT committed at least to ensure all level 4 facilities do have no-fee network within, or at least all the nodes of the primary care networks do have the no-fee connection. Yeah, and then the third, we were looking at certification of all data centers to meet international standards, and one of the standards is the one from Uptime Institute, which classify data centers in 4 tiers. Yeah, and they are quite elaborate. Yeah, so they start from the time you're building the data center to the time you're actually having it complete, and then just keep on following that. Yeah, so that's what we are looking at. But apart from that, there can also be other standards that can come, which ICT can help us come and see. So once that one's done, then we'll say all our registries and all those things will be secure and will be handled properly. Yeah, and then we're looking at developing some guidance on utilizing the public cloud that will come. So eventually when Google Cloud, AWS, and Microsoft build in their data centers in this country, and of course we know they are public cloud, so how would we be able now to define how we can be able to utilize the same platforms? Because you can have also private sector players who would wish to be able to utilize such kind of platform. So developing guidance around that, I think working closely with the policy team is something which has to be considered. And we're looking at that one being done maybe in about 12 months, maybe to be defined also within the digital health or e-health bill, or some of the policies just looking at digital health. And then we're looking at also, we say that in terms of level 2 and level 3 facilities, we want the servers to be in data centers. We don't want servers to be at those levels because the kind of human resource capacity able just to ensure that things are running smoothly there is not adequate. So it's very suitable for it to be up there, and ECPAF committed to provide technical support, and then as we progress, then maybe there can also be financial support coming through that. And that one, the implementation can start as soon as today, but within 12 months, we should be able to have that worked on as we work on getting the resources. And then the sixth one was just to provide optimal power backup at all facilities. We know when you use digital devices, they require power. So there has to be some alternative power apart from the main grid. And in areas where maybe there is no main grid, then at least the sources of power needs to be two for just to ensure that there will be continuity of services in those areas. And that is part of significant investment that might come. It's part of the specification which will define, and we are looking towards achieving that in about 24 months. I know there is the vision for by December, but as we keep on implementing its facilities, we have to just spread it through. And then we have the aspect for capacity building of end users. Yeah, because they are not used to using some digital devices. It's quite good that the Android devices are quite ubiquitous, so it's much easier for them to use, but they still have to learn to use other devices, so that as the patients are being served, and is trying to drink and punch, trying to look for letters when they are entering data within the various. Yeah, and this will be continuous, depending on the zone. And ICT committed that will be able to execute that. And then also the aspect for collaboration with the mobile service providers, just to enhance the cellular network coverage, because that is what really supports the CHPs, or the CHPs, the CHPs for the second level, that is the health centers and the dispensaries. We're looking towards just having also the mobile devices of the time, which might require maybe some computer, because there are some laboratory kinds of functions for them to work optimally. So those are some of the things that will be there, including a local area network just to ensure the entire facility is networked. Yeah, but all their servers will be at the data center. That's what the recommendation is, so that now at the data center, the community health volunteers are connecting the each.
So that now we can ask the team some questions. And before the plenary comes forward, I have a question. We have a problem in this country when it comes to infrastructure. ICT is a recurring dispute. And one of the issues we have, I don't know, is lack of guidelines, policy. You can go to a facility, and for example, you enter in a department, an example MCH, and you find that in FP, we have 3 computers, and they cannot share, because this was brought by this partner, or FP, this one was brought by that one, this was brought by that one, and they are how is it about how we measure the support